Welcome to our final episode of Season 2 of Senior Care Insights. This week we have some interesting guests who will be sharing some information on senior care as well as about the shortage of direct care workers. We would like to thank our sponsors this season as well. We've had Brookdale Meridian and Courtyard at Delta who have graciously sponsored the show so more people are educated on the topics of senior care. Today we have Mandy Brand from PACE, Chelsea Scripter and Pattie Thayer from Elara Caring, and finally Bethany Dizer from Impart Alliance. Stay tuned.
I appreciate the fact that we chit-chat, we have a little bit of a 10 minutes of conversation.
Somebody that I can talk to and somebody that another person that's my age that's actually here for me.
She comes twice a month. They were here to take care of my husband, help me with housework, cleans my kitchen, my front room, and mops my floors. Believe me, it's a godsend right now.
Able to take me to the store, cleaning the house and just talking to me.
I really enjoy helping the clients and getting to know them and companionship and helping them stay in their home and feel independent.
I find my job rewarding, making a difference in people's lives and helping them out in any way I could.
I recommend working at First Light Home Care. They have flexible hours and you get to be a great relationship with the client and feel like you're making a difference.
Like I say, we not only become our caregivers, but also friends.
If I didn't have a caregiver here, I would be struggling on a daily basis. And when she comes in and does it, it's such a tremendous help to me.
Welcome, Mandy. This is Mandy Brand, and she is from the PACE from Senior Community Care of Michigan. How are you doing today?
I'm good. How are you, Deb?
I'm doing great. Tell us a little bit about what you do at the Senior Community Care PACE facility.
Sure. So I'm the Marketing and Enrollment Manager. I'm also a nurse here at PACE. What I do is just go out into the community, explain what our program does for the elderly. I also do the in-home assessment to determine qualifications into our program.
Okay. And so what is PACE exactly, and what does that stand for, and what services do you guys provide?
So PACE stands for the Program of All-Inclusive Care for the Elderly. Here in Lansing, we provide services to individuals in the Ingham, Eaton, and Clinton County area, parts of Shiawassee, and parts of Ionia County. We provide the primary care physician. We also have RNs on call 24 hours a day. Home health aides that could go into the home and assist with many things such as housekeeping, laundry, showering, small meal preparation, grocery pickup, things of that nature. We also provide transportation to and from all of their needed medical appointments and to our center where they would come in for activities, socialization, lunch. We also have a physical therapy gym there, and that's where they would come for the clinic use to see the primary physicians. We become their pharmacy as well, and we deliver medications right to their home. We have a social work department. We also have a mental health therapist if needed. I'm trying to remember what else. We have a lot of different things that we assist with in the community. We help collaborate medical care for the elderly that are not able to do it for themselves. We also work with their family members in order to get their care collaborated, and we welcome any help that they're able to give as well.
So you have a day center. What all do they do at the day center?
Yeah, we have all different kinds of activities. They put out a monthly calendar every month. I've known of them to go on zoo trips, do movies, have our chaplain there to sing, play the guitar. We also provide lunch while they are there. We are open Monday through Friday. Some of our participants come in every day of the week. If they have family members that work and they're unable to be left alone for safety reasons, such as dementia, other individuals come maybe a couple days a week, half days. It just depends. Our interdisciplinary team would definitely meet with them to determine how many days a week they would be coming to the day center.
Okay. So what are the income and asset requirements for using your program?
So we do have individuals that can pay privately, or if they qualify for what we consider PACE Medicaid, there's no out-of-pocket expense to them. So for the PACE program, we do only take on Medicare and Medicaid, no other health insurance. If individuals state, well, I've been denied for Medicaid in the past, it does not mean that they would be necessarily be denied for PACE Medicaid. We have a higher income threshold. Currently for 24, it is $2,829 in income or less. But that may change in 25. So what we would do is just go over their asset and income limit to determine if they may qualify for us. And I can always assist them with a Medicaid application. In order for individuals to qualify for the program medically, they have to be 55 years or older, live in one of our service areas of the counties I mentioned before, Ingham, Eaton, Clinton, parts of Shiawassee or Ionia, and be qualified for a nursing home level of care. Some individuals may get that confused, like, well, I'm not ready for a nursing home yet. But our goal of PACE is to keep them out of a nursing home. So we want to know prior to that if they may be getting close to it, or if they're already at that level and they don't want to leave their home. Our goal is to keep them there. We feel that they thrive better in their current living arrangements. We don't take any of their money or we don't pay any of their bills. They are responsible for that. But for individuals to qualify for a nursing home level of care, there are several different sections of the assessment that would need to be completed, such as physical or mental inability to care for themselves, or if they're falls, multiple emergency room visits, shortness of breath that's inhibiting them from providing their own care, such as dressing is very difficult for them, or anything like that. If they ever question if they may be eligible, they can always give me a call and we can go over that. We do place individuals in nursing homes later in life if they're no longer safe in their home, but our goal is to not do that and to keep them there with our care.
No, that's kind of our goal too. When doing home care, we know that people do tend to do better when they're in their own homes. So, but I know that some people are not able to afford regular home care services. So I often have provided the PACE information to them so that they do have a different option if they're not able to pay. So I like to always give resources to everyone. And PACE is one of my main resources that I hand out to people. So
we appreciate that. We feel that, we want to help every elderly individual in the community that we are able to. If we do determine that they're no longer safe in their home and they are a current participant of PACE, then we do look into moving them into assisted living facilities if need be. We do pick up the cost of caregiving. So we do not necessarily send out any of our caregivers there, like home health aides. We pay them to provide the caregiver. We do still send out our nurses. We are still their physician and their transportation to their medical appointments and things of that nature.
So the caregivers still follow them, or they do not?
Not the home health aide. All the rest of our interdisciplinary team would, but not the home health aide.
Oh, okay. And so what are the hours of care that PACE provide in the home? So how many hours do people typically get, or is that just based on their needs? And are people getting 8 hours a day at home, or are they getting, a couple hours in the morning, or does it all vary?
It does all vary. After my assessment to determine if they qualify for the program, then they would meet with our interdisciplinary team. That would include all of the care members that I had mentioned prior to. The home care nurse and the occupational therapist would schedule a time to go to the home together to determine their care plan, care hours. So what we do is we don't actually say you're going to get 4 hours a day. We do like stop-in care. Let's say they need somebody in the morning to help them get up, make sure they've had a meal, taken their medication, gotten dressed, used the restroom, and then we leave and we go check on other participants. We come back later in the day if need be, make sure they've had their lunch, more medications if needed, restroom breaks. We obviously every individual is going to have a different care plan. Some people may not need us every day. Some people may be coming to the day center throughout the day, so they don't need the stop-in care. We may have to go in the morning and get them ready before the bus picks them up for an appointment. We also, there's a lot of services that say we do a minimum of 4 hours. We don't do that. We don't stay in the home and safety sit. We cannot do 24-hour care. If they are not safe to be in the home, we do require them live with family, or in the future, if that's no longer safe, we do look into assisted living facilities. But we don't just provide sit-in care, if that makes sense. And we are not allowed to stay there overnight. We have to be out of the home by 9 p.m. So we can take individuals and get them into their bed, and then we leave and come back in the morning and help them get up.
Okay. That sounds interesting. So when people go to PACE during the day, besides the day center, you've mentioned that there's physical therapy as well?
That is correct. We do have a full physical therapy gym. If our physical therapy department feels that this individual may need more therapy, we do not need a physician's order necessarily. Our care team can just make that decision and start therapy with them.
Okay. So, go ahead.
We also do not need a referral from a physician to join our program. Any individual can call and we would determine if they qualify.
Okay. So what's the best way for somebody to contact you to get an assessment? And who would do that? Would that be the client themselves or anybody in the family?
Anybody in the family can do that. They just have to have the actual individual's permission. So unless, of course, they're deemed incapable of making medical decisions, then we would need that power of attorney to do that for them. They can go on our website, which is across the bottom of the screen. There is an option there to make a referral, or they can call me and I can take the referral over the phone.
Okay. And all referrals go through you, or
Correct.
Are there other people?
No, just me.
Oh, nice.
I like to do it from start to finish. So they don't have any middleman, they don't get lost. It's just me.
Okay. And how big is your team that you work with to provide the care to all of the individuals? And what counties do you cover as well?
Yeah, so we cover Ingham, Eaton, Clinton, parts of Shiawassee, and parts of Ionia County. We have 4 different care teams that cover those areas. So each care team has an RN, a nurse practitioner over their care. They would have home health aides, social worker, physical and occupational therapist. We also have a dietitian. We have the same disciplinary team that you would see in a nursing home. We just provide that care there in their home and at our center, as we don't have any beds or anywhere for them to stay. Currently, we have 237 active participants in our program, meaning that those are our patients, but we do consider them our participants. And we have a capacity of 300 or more. So we will be extending that if need be.
Oh, that's awesome. That's awesome. Do you have anything else to share about the PACE program?
I think that we may have covered everything. Let me just look over my notes to make sure we haven't missed anything. The transportation service, I did forget to mention, we do door-to-door service. So, and we also provide the durable medical equipment if needed. So if they need a ramp on their home and they enroll in our program and they can't safely get out, we place that ramp on their home at no charge to them if they are a PACE Medicaid participant. But our transportation go right into the home, get the participant, and take them right to the van and then right into their appointment. We cannot stay at the appointment with them. They will need a caregiver there if they require one, or if they are, cognitively aware, they can stay themselves, and we just come back and pick them up.
So how long does it take for someone to get a ramp built if that's what's needed to get them in and out of the home safely?
Sure. It would depend on the service that we hire, but I've known of individuals to get them on the home within the week that they enroll. We do enroll participants at the first of every month. We do have a cutoff day of the 24th of the month prior to have all of our assessments completed to enroll for the next month. So our next enrollment period would be January 1st. And there is a lot that goes into the enrollment. So, it takes a few days to get everything in order. And then again, once they enroll, we would determine what type of medical equipment is needed to keep them in the home safely.
And how many participants do you have right now, approximately?
Currently we have 237.
Oh, wow. That's a lot of people to take care of.
Yeah, that's why we have 4 different care teams handling all of them.
I understand. Yeah. Okay. All right. Well, thank you so much for joining us on the show today. We appreciate all the information you provided. And I think it's a great service for people who need those services but cannot afford to pay for them. And like I said, I'm always recommending the PACE when we see that it's a situation that's best for them. So
we appreciate every referral. We also do take private pay if they don't qualify for PACE Medicaid as well.
Okay. That's good to know. All right. Thank you and have a wonderful day.
You too.
Exciting things are happening here in Delta Township. The courtyard at Delta is well underway, constructing your brand new home, bringing the finest in senior living and care to the West Side.
We'd love to have you join us for an appointment here at our sales center in Grand Ledge, or see you at one of the many events that we host, where we can learn more about you, your needs, and how we can best serve you and your loved ones at our new community.
Call us at 517-775-6217.
Welcome to our guests, Chelsea Scripter and Pattie Thayer from Elara Caring. How are you guys doing today?
Good. Thanks for having us on.
Yeah, thanks for joining. Okay, so I have a few questions for you guys. First of all, Chelsea, how much does hospice cost, and does insurance cover everything with hospice?
Yeah, I think that's a great question, Dr. Deborah. And the unfortunate reality is that most patients who are eligible for hospice aren't working, right? So they're on a fixed income. And I would say probably 7 to 8 out of 10 admissions that I do, that's one of the main questions that people ask, because they're concerned, not necessarily for themselves, but for their family who, once hospice services are completed, are probably would have to pay for it, right? So the great news that I'm able to provide them is that Medicare pays for hospice at 100%. If a patient is not Medicare eligible, private insurance, Medicaid, Medicare Advantage plans, or the VA benefit also sees it as an important service, and they provide the payment for those things.
Oh, wow. Even the VA does. That's awesome. Mm-hmm. Okay. So nobody has any out-of-pocket expenses at all when they get hospice, correct?
So typically, no. There are some, when someone reaches hospice care, some private insurance companies, there is a deductible. I will say when you have a life-limiting illness, most of the time the deductible is already met by the time that they reach our care.
Oh, okay. All right. Pattie, do you have to be on DNR or be a DNR, do not resuscitate, to be on hospice?
You do not. That's also a great question that I get asked a lot from the families. Some patients are just not ready to be a DNR. So you can come onto our hospice services without being a DNR, and you can sign a DNR whenever you want. If you don't want to sign it at the initial assessment and what we call a start of care, you can sign it in a month, 3 months, 6 months, a year. You can sign that whenever you feel comfortable signing that.
Okay. I know a lot of people think that once they go on hospice, automatically that nothing's going to be done to help them, that they're just giving up. So another question that I often hear is, do you have to stop all of your medications when you start hospice services?
That is another very common question that we get asked. You do not have to stop all of your meds. However, our medical director and our admission nurse will make suggestions. for sometimes we can add a medication or sometimes we can withdraw a medication. Sometimes if the patient is having a hard time swallowing and they're taking a lot of supplements, let's say like over-the-counter vitamins, things like that, they will make suggestions to possibly discontinue the supplements if they're, maybe having a hard time swallowing or something like that. But I always tell my families that they will be involved in that conversation around the medications. So if a family really wants their loved one to remain on whatever medication, that will be discussed during the assessment and the start of care. And so we always like to bring the family in and have them involved as much as possible so they're not feeling left out. And it's not our way or the highway. It's definitely a family decision, and we work with the families on all levels.
Okay. All righty. So, Chelsea, what types of services does hospice provide?
Sure. So before we get totally into hospice, I think it's important to discuss all of the services that Elara Caring provides in total. We are one of the largest home-based care providers in the nation. We service 18 states, which is huge, and we're providing 10 million visits annually to the patients that we service. And so there's times, right, when patients don't feel ready for hospice. And so we have home care services, we have palliative care services, behavioral health, patient care services, which is like attendant care in the home, and then, of course, hospice care. And so the great thing is, like I said, if they're not ready yet for hospice, we do have these other services that when they are ready to transition, it can really be seamless. And then when we talk about hospice care, we have what we call an interdisciplinary team, and that encompasses the nurse, the home health aide, the physician, the social worker, and the chaplain, because we know the holistic approach is what really sets hospice apart. And we are able to meet with, like Pattie had talked about, the patient and the family and provide advanced care planning, which is really essential in providing unique goals for each and every patient so that they are able to drive the plan of care. And comfort looks different for every single person. And so ensuring that we're meeting with the whole family, utilizing the entire interdisciplinary team is, I would say, hugely valuable to any patient who's on hospice care. We also provide durable medical equipment. We can get a hospital bed in the home, oxygen in the home. When you're on other plans or you're doing home care, it's not as easily accessible to get those things. So that really eases the burden of care when someone is taking care of someone in the home. Pattie had talked about, we cover the medications that are involved in the symptom management. And, if it's related to the terminal prognosis, heart medications, when we continue those medications, we pay for all of those. We pay for incontinence supplies, or if a patient has a Pleurax cath, for example, or a drain, to drain fluid to make it easier for them to breathe. We can provide the equipment necessary for those to be provided or drained in the home so that they're not having to go to the hospital to get that done. And then one of the other great services that is provided is called respite care. And that really gives the family time, 5 nights, 6 days, where we're able to put the patient in a skilled nursing facility free of charge for the family so that they are able to refresh. As it's a huge undertaking to care for somebody in the home. And so we're able to do that for patients and families as well.
Oh, that's a nice service. A lot of people do need that respite care for sure. Yeah. We see that quite often because the family member who's taking care of a member who's ill often starts declining as well. And that's really a great service to provide. So, Pattie, tell me a little bit about what your role is at Elara Caring.
So my title is account executive. I like to refer to myself as a hospice liaison. So I'm in front of say like the hospitals, the facilities, the physician offices, and I'm explaining the services that we provide. And I'm also teaching a lot at those same facilities, hospital docs' offices, but I talk to families a lot. So when a referral comes in, I'm usually the first person to call the family and just make sure that we're all on the same page. Sometimes, there's a little miscommunication. Sometimes, if the order came over to me as a hospice order, but really the patient wanted palliative or home care. So I tread very lightly on the first couple sentences of just, how I came to get their phone number and, who called me. And then just making sure that we're on the same page, is your loved one interested in hospice care? And about 99% of the time, that's it's accurate. Mm-hmm. And then we just go straight into what hospice is. I try and do like a broad teaching with them, covering like the main 3 points of, everything is covered at 100%. There's usually no copay. It involves nursing, equipment, and meds, and everything is delivered to the home. Unless they're in a facility, then obviously it's delivered there. Then we talk about when they would like us to come and see their loved one. And if they're in a hospital, I have to work with the case manager of the hospital to set up transportation, set up medications, have the physician call in some meds, and then we get them home. We schedule our admission nurse to go there, and it's really a seamless dance. Really, it goes very smoothly. And then after the patient is what we call like the start of care or admitted onto our services, I kind of bow out. My job is done. And then the patient is given our main branch number. And if the patient needs anything, the family needs anything, they're given a different number to call. As I don't do scheduling, I don't know what the nurses, what their day looks like, things like that. So most people, when I touch base with them, I always text them so that they have my name, my number, my company name. And sometimes they have my number, so they'll call me back, and that's fine. I'll talk to them again, no problem. But a lot of times I'm referring them back to our main branch, just because I don't do scheduling and things like that. So
okay,
that sums up my job.
All right, Chelsea, what do you do?
Sure. So my role as a branch director is to ensure that operationally everything runs smoothly, right? So we have a clinical manager in the office who is really in charge of the day-to-day things, as Pattie was talking about. He ensures that we're scheduling things appropriately, that all of the patient needs are met. And I meet with the entire team as we discuss every single patient and their goals and their needs and how we can ensure that we are meeting all of their needs and their goals as an interdisciplinary team. But my role is really the oversight at a higher level of the operational team.
Oh, okay. So Pattie, I think you mentioned this when you were just speaking, but hospice can be provided at home, but what other areas or where else can hospice be provided?
So part of our logo and our slogan is we care for the patient anywhere they call home. So most of the time it is home, but sometimes it's not. So they could be in, let's take it from like the lowest level of care, of patient care. We could talk about like an adult foster care or a senior living facility. Somewhere where the care is, it's not substantial. You move up from there to an assisted living, kind of the same thing. we're not caring for the patient. The patient is pretty independent at that point. But we can still see the patient in any of those facilities. The most care happens at a skilled nursing facility. And that's where there's nursing care 24/7. We come in and we partner with that facility, actually at all of the facilities. And the patient is not only receiving the care at the facility, wherever they call home, but we come in and we partner with that facility, and we're also caring for that patient.
Okay. I think a lot of people don't realize that hospice is usually done at home. They think they have to go somewhere, but I mean, there's so many myths about hospice, so it's good that we're talking about all of these. So if a patient doesn't like hospice, can they stop having hospice at any time? Or what if they don't need it anymore?
You want to take that?
Sure. So we are every IDG talking about eligibility, right? We know Medicare has clear guidelines on what makes a patient eligible for our service. And so there have been times where we discharge for lack of decline, and we call it graduation day, right? It's an exciting day where we're saying, well, although for sure everyone benefits from hospice care, they are no longer eligible. So we do ensure that we discharge plan with them, right? We make sure that we have a primary care physician who can write orders for them. If they have a skilled need, we send the referral over to the skilled home health division. And maybe palliative care is needed also. Our palliative care division is great at really also providing a holistic approach to the patient. They're looking at every single need. And so that is exciting. And then also, absolutely, people have the right to make any medical decision that they deem appropriate, right? So they can, what we call revocate hospice services if they desire to pursue what we call aggressive treatment, or they desire to get a higher level of care, whatever that is. They, want to get cancer treatment again or dialysis again. There is that option.
Okay. And finally, what areas do you service? Are you just in the Lansing area? I know you mentioned 18 states, but locally, what areas do you cover?
Sure. So locally in the state of Michigan, we have 9 branches. We have a branch in Bingham Farms. We have a Big Rapids branch, Clinton Township, Adrian. We have, of course, the Lansing branch, Jackson, Grand Rapids. We really have branches all across the state that are able to provide care to the patients in the surrounding areas.
Awesome. Is there anything else that you guys would like to add before we end our little discussion on hospice?
I'd like to add that one of the things that makes Elara Caring Hospice stand out to any other hospice, because patients have a choice, but one of the things that we do best is we see the patient the same day. And that's huge. I worked with a patient this morning where the referral was made last week to another hospice company, and they hadn't even heard. They never even received a phone call yet. So we received that referral and we were out there same day. So
that is good.
It's a big deal when you know you need services in the home, you just need some help. And it's so comforting to know that a nurse is on their way. So we are doing same day starts of care, and we're really proud of that.
All right. Well, thank you so much for joining us today.
Thanks for having us.
Have a good day.
Exciting things are happening here in Delta Township. The courtyard at Delta is well underway, constructing your brand new home, bringing the finest in senior living and care to the West Side.
We'd love to have you join us for an appointment here at our sales center in Grand Ledge, or see you at one of the many events that we host, where we can learn more about you, your needs, and how we can best serve you and your loved ones at our new community.
Call us at 517-775-6217.
Time is valuable, especially when it comes to caring for a loved one. Instead of spending your day juggling caregiving tasks, you could actually spend quality time with your family, enjoying the memories, playing games, catching up on work, or simply relaxing and getting recharged. A client review stated, "We used First Light Services to care for my mom for almost 3 years in her home. We were very lucky to find such loving and compassionate caregivers. They were knowledgeable about mom's issues and truly cared about her well-being, as well as helping the family learn how to adapt to her changes. Our caregivers are professionally trained, background checked, must pass a drug test, and are compassionate. We offer flexible plans tailored to meet your family's needs, ensuring that you get time back in your day without compromising the quality of care. Don't let another day slip away being a caregiver. Make the call today and let First Light Home Care of Greater Lansing illuminate the pathway to exceptional home care and give you back the gift of time." I want to welcome our next guest, Bethany Dizer from the Impart Alliance. This is our last guest of the season, but last but not least, here's Bethany. So Bethany, how are you doing?
Hi, wonderful. Thank you for having me.
Well, thank you so much for joining us today. Tell us about the Impart Alliance at Michigan State University and what its mission is.
So the Impart Alliance is an organization that supports the development of a more robust direct care workforce here in the state of Michigan. At Impart Alliance, we see the interests of direct care workers as well as the older adults and people with disabilities that they support as inextricable. We advocate for both through programming, coalition building, and innovation, that it really exemplifies the belief that better jobs mean better care. And that kind of great quality care leads to a more just and healthy community. Some listeners might not be familiar with the term DCW or direct care worker, which I use all the time. According to the Direct Care Workforce Advisory Committee, a direct care worker it's an umbrella term, and it covers individuals who provide essential services in behavioral health, community mental health, long-term care, all those types of settings. They provide essential services and supports like personal care, hygiene, or more home care services like cooking, cleaning, and shopping. They work in all kinds of settings. Nursing home settings, assisted living, adult foster care, as well as private homes in the community. You may know direct care workers by some other titles and job types like certified nurse aide, home health aide, personal care assistant, what else? Direct support professionals, companions, caregivers. But again, it's a big umbrella term, and it involves a lot of different kinds of work and a lot of great settings. And here at Impart, we want to advance their interests to really build that workforce so that it's adequate in number and preparation. Impart, this is the number one question I get all the time, is what does Impart stand for? It stands for an integrated model of personal assistant research and training. And we're housed within the College of Osteopathic Medicine here at Michigan State University. And the organization was started several years ago based on the work of our director, Dr. Claire Luz.
Nice. Yeah. So you're a nurse, I understand. And can you share about your journey and why you wanted to join the efforts behind the Impart Alliance?
Yeah, so I am a nurse my whole career. I'm also an adult gerontological primary care nurse practitioner, and I have a clinical background working primarily with older adults. And while I was out seeing patients, receiving long-term supports and services, maybe in the nursing home or assisted living setting, I encountered a lot of really great direct care workers providing exceptional care. But very often they just weren't receiving the support that they needed to do their work to the very best of their abilities. And the truth is, in this kind of setting, that the relationship between the person and the direct care worker is really the functional unit of long-term supports and services. And all the other healthcare, social services, everything that I was doing as a nurse practitioner, it's really all auxiliary to that direct care worker and person relationship in terms of improving someone's health and quality of life. And I knew that if I really wanted to make an impact and improve the care of my older adult patients, I needed to focus on improving the quality of long-term supports and services and start by supporting direct care workers. So when I had the opportunity at Impart Alliance to use some of my clinical knowledge from my nursing career to help educate and train direct care workers, I jumped at the chance.
Training is essential, obviously, in so many ways. And as a former teacher and educator, I totally understand that has to be done on a higher level basis. And that's kind of what we do here, but there's always more that we want to do as well. So currently, we all know there's a shortage of direct care workers in the state of Michigan. And so tell us about that and how the Impart Alliance is advocating for that change.
Yeah, this is such a great question. One I hear all the time. And I always want to start by kind of reframing the question and talking about that direct care workforce shortage. And I think the first point to really start with is that our lives are longer. People are living healthier, longer, happier lives with chronic illnesses and other conditions. And more people are choosing to age in place in their homes. And so what good fortune that as a population, as a state, we need an estimated 30,000 plus more direct care workers, right? I never want to suggest that the lack of access to direct care worker services is a shortcoming of our existing workforce. Instead, I hope that listeners hearing that there's an enormous career opportunity in this field. Nationally, it's estimated there will be a 39% growth in all direct care worker occupations predicted to occur from 2022 to 2037. So our lives are getting longer and healthier. There's more need for direct care workers. There's a huge opportunity for growth in this sector, but we're faced with the challenge of how do we make these really good jobs and careers that people want to pursue and remain in for their whole working lives. And so here at Impart Alliance, we really imagine 4 pillars to supporting direct care workers. The first is, of course, improving compensation and benefits, which we know is huge. In addition, the second pillar is really about elevating the value of the profession socially and in the community. Third, we work hard to advance the innovation, knowledge, data, research in this field and discipline. And then the final pillar is all about professionalization. And that includes competency standards for work performance, quality training, credentialing, career pathways that are lifelong, and really the supports needed for someone to have success in their careers. And that fourth pillar, that is where I spend the majority of my time.
Okay. So let's talk about training direct care workers. Why is that so important, and what kinds of training do you offer?
Yeah, we have a lot of great programming. And in the surveys of direct care workers about their intention to leave the workplaces, researchers have really found that the level of empowerment that the worker feels at work really heavily impacts their intention to leave. And so what that includes is this concept of confidence, preparation, engagement, participation in decision-making and how the care is provided. And training is really a great way to address those challenges in individual workers. When you get training for a job, you don't only learn how to do your job well, you also learn how to think and how to problem solve and plan in response to a really complex healthcare environment that a lot of these people are working in. You also learn how can you contribute to your organization and the profession on the whole to make it better. And that was really the incentive behind building the workforce, right? Is to help people be prepared and workplace ready, and they're equipped to stay employed. But we also have to think about how training improves the health outcomes for the individuals that direct care workers work with, right? Impart Alliance's first name of the program that we originally were delivering was called Building Training and Building Quality. And that's this apt name because it really represents that the people who receive these services, the quality of those services are directly tied to the quality of the training and knowledge that those people possess when they're providing direct care. And we really try to make sure that that lives on in our current training offerings. We use a person-centered approach to care, and that's really this idea. Person-centered thinking means that the person is the expert in their own life, and that their long-term supports and services plan should really honor their preferences and their values. Direct care workers are integral to the provision of person-centered care because they're often the best advocates for the people they support, and they know the person the best because they're providing so much direct care every day. And in terms of our communities, why does training matter? Because a well-prepared, adequate, competent direct care workforce is essential to all of us. I think it was Rosalind Carter who famously said that everyone is going to be a caregiver or receive the services of a caregiver in their lifetime. And that is so true. Direct care workers support families in our neighborhoods to care for their loved ones, right? To allow people to maintain their work outside of the home and to maintain their relationships and family life and have healthier, happier lives residing in the community and ensuring that their loved one is getting good quality care. I've been asked if I think, that this is like a workforce issue or a healthcare education issue. And I think here at Impart Alliance, we know that it's an everything issue. So we want to use training as an opportunity to advance direct care workers' profession in terms of more workers, better skilled workers, greater worker longevity, but also the quality of the care that they're providing, that it's based on good, solid foundations, that it is delivered well, and that direct care workers know how to respond to complex situations and maintain good relationships with the people that they support.
Okay, so are there different levels of participation in the training? And let's say I have caregivers that I would like, or direct care workers that I would like to attend the trainings. How do they do that?
Yeah, so we offer a 4-level core curriculum. It addresses the core 15 essential competencies that all direct care workers need. We deliver it live in a hybrid format. So it has a virtual component as well as an in-person part. It's taught by trainers who have experience and work in the field and that have also been trained in how to deliver our curriculum. It's stackable and flexible, and anyone can sign up to take it, really. If you're a current or future direct care worker, you're welcome to participate. Eligibility, we just require people are 16 years of age or older, able to work in the United States. And for all of our virtual offerings, you need to have access to a computer with the internet to participate in those. We don't require that our participants have a high school diploma. We don't require English proficiency testing, but we do like to notify people that all of our trainings are currently offered live by a trainer, and they are all conducted in English. If you're interested in taking training, we're very fortunate to have generous grant funding from the Michigan Department of Health and Human Services, partially through fiscal year 23 general funds, as well as through the American Rescue Plan Act, Home and Community-Based Service Spending Plan funds. So all of our training that we are offering here at Impart Alliance is currently free in the state of Michigan. So if you are interested in either advancing your skills as a direct care worker, entering the field, or exploring a healthcare, consider taking a course from us. So our website is on the bottom of the screen. It's impartalliance.msu.edu. You can also email us at it's impart@msu.edu, and send us an email if you're interested in signing up, taking a class. Now is the time. I often find myself saying there's no wrong door to enter direct care, right? I'm sure you have as well worked with a lot of nurses, physicians, therapists, social workers who began their careers as direct care workers. And when they were exposed to these other professions, they decided to pursue additional training and credentials. I also meet a lot of direct care workers who started their career really after being a family caregiver for a loved one, and that experience was really meaningful to them, and they decided to make it their profession for their life. So if any of those stories resonate with you, or you're just considering a new exciting job in healthcare services in a rapidly growing, complex, fast-paced healthcare environment, like, this is a great first step for you. Consider taking some training.
All righty. Is there, if a company wanted to have all of their employees trained through this, is that an option?
Absolutely. We encourage employers to really consider the use of training as a tool, not just for skills preparation for your workers, but see it as part of that retention and recruitment plan, right? We want to see direct care workers have the opportunity to advance their careers, to earn additional skills, to build, a career-long professional story that includes training, opportunities, leadership, skill development, skill advancement, learning additional new skills. So if you're an employer in this field, and which I'm sure resonates a lot with you, it is hard to maintain employees. It is hard to recruit, and it's hard to retain. And I hope that all employers would consider training as a really great tool to build up that empowerment. And it's also a great time to get to know your employees by offering training. One of the greatest parts of my job is when I do training with direct care workers, because it's live. They're all in a meeting together. And very often direct care workers out in the community work alone. They don't get that time to network, to share their experience, to learn from their peers about, like, how do you deal with this? What are you doing at work? And this is a great opportunity to see what your employees are doing, to hear their stories from the field, to hear about how they're innovating and where their skill sets as leaders in your organization might lie. So it's a great opportunity if you're a direct care worker working on your own or looking for employment and you want to build up some resume items and skill sets, but also so great for employers if you want to foster engagement, leadership, and participation among your employees for retention.
Well, thank you so much. Is there anything else you'd like to add to share about the
I always just want to remind people how inherently valuable care work really, really is. The most important relationships in our lives involve caregiving. And so I think I just want to spend my last couple of minutes recognizing the value of the individuals who have decided to make caregiving their profession. So if you are a direct care worker listening to this, thank you. Thank you for the quality of care you provide to the people you support. Thank you for your commitment to improving the quality of your profession. Thank you for making our communities better, more equitable, healthier places to live. And if you're not a direct care worker, I hope you'll consider joining me in finding a way to show your respect and gratitude to this really dedicated workforce. You can join our coalition by visiting our website and find a lot of great ideas to get involved, whether you're a direct care worker, a community member, an employer, anyone.
Well, thank you so much for all the information today.
Thank you. It's been a pleasure.
Exciting things are happening here in Delta Township. The courtyard at Delta is well underway, constructing your brand new home, bringing the finest in senior living and care to the West Side.
We'd love to have you join us for an appointment here at our sales center in Grand Ledge, or see you at one of the many events that we host, where we can learn more about you, your needs, and how we can best serve you and your loved ones at our new community.
call us at 517-775-6217.
I want to thank our guests today, Mandy Brand from PACE, Chelsea Scripter and Pattie Thayer from Elara Caring, and Bethany Dizer from Impart Alliance. In addition, a very special thanks to our sponsors for this year included Brookdale Meridian, as well as Courtyard at Delta. And we've had a wonderful season too. We will be back next year. Happy holidays.